and I'm filling in for our chairperson today. Do we have any public participation?
Doesn't appear to be any.
Okay. Sorry, Lisa, do you want everybody to introduce themselves, or do you want to just go straight into the meeting?
We can do whatever you prefer. I can see everyone's names on the side, so I can get a record that way. But if you'd
Okay.
like to go around and have people introduce, we can do that, whatever you prefer.
No, we'll skip that part. It gets a little confusing. So I need did everybody have a chance to read the minutes from the last meeting? And if so, I need a motion for an approval.
So moved.
Would you mind stating your name when you make or second a motion so I can get it for the minutes, please?
Yep, Logan Haynes, KMHI. I make the motion.
Thanks, Logan.
Zach Worsham, second.
Thanks, Zach.
Next on the agenda, we have Lee Werner, Director of Ohio, Kentucky, and Tennessee Program, the Corporation for Supportive Housing. She's going to talk about maximizing new Medicaid benefits to scale supportive housing. Lee, are you here?
I sure am, Leah. Nice to see all of you. I see Ray from St. John's and Kathy from Wellspring, so you all know this information. So happy to be here with you all. Yes, my name is Leah Warner. I'm the director of the Ohio, Kentucky, and Tennessee team at the Corporation for Supportive Housing. Next slide, please. So I know some of you know who we are. We've been working in the state of Kentucky for about 5 years, but CSH is a national organization. We've been around for 35 years. We have a presence all across the country, and our North Star is about elevating supportive housing as a key housing intervention for vulnerable populations. And we do that through training and technical assistance, policy and advocacy work. So, we're up to our eyeballs in that right now. And we're a lender. We lend financing to mission-aligned supportive housing projects. So for some level setting, when we talk about supportive housing, we're talking about housing that is deeply affordable, where folks are not spending more than 30% of their gross annual income on housing. And if their income is zero, that means the unit is fully subsidized. And access to voluntary, tenant-centered, and robust supportive services. And the best way to really think about populations of people that benefit from a supportive housing intervention, it's the but-for rule. But for affordability, people wouldn't be housed, and but for services, they would not stay housed. So when we think of the populations that benefit from a supportive housing intervention, it's like Sheehan Landing that St. John's is shepherding in the south side of Louisville, working with folks who are exiting street homelessness, who have profound levels of mental illness and substance use disorder, to provide them the support that they need to stabilize and thrive. So CSH has actually been working with the state of Kentucky and the Kentucky Housing Corporation for about 5 years now. And that was really sprungboard into action when the American Rescue Plan was passed at the federal level, infusing communities with funding in response to COVID-19. And there have been 2 big buckets of work that we've been focusing on in partnership with KHC, Department of Medicaid, Department of Behavioral Health, and IDD. So we've been focusing on expanding the pipeline of supportive housing in the Commonwealth. That included 2 comprehensive training series. Now we're moving into ongoing technical assistance for our supportive housing development teams as they move from development to operations and management. The second big bucket of funding has been around Medicaid, has been around this new RISE initiative that really is the key to scaling supportive housing and helping communities reduce incidences of homelessness. Next slide. So I asked this slide to be updated, but it didn't happen in time. Kentucky should be purple. So you see 17 states here, state Medicaid agencies like your agency in Kentucky that have created services and benefits that really help move the needle on addressing homelessness. And there's this big umbrella definition that's important to know. Housing related services, services that are connected to someone's housing that helps people move from crisis to stability to thriving. And the types of benefits, there's a lot of nuance there, but at the end of the day, it really, the common thread is honoring the truth of social determinants of health, that when someone has access to housing and services, their physical and mental health improves. So a fun fact is when someone's living on the street of Louisville and they're 55 years old and they've been on the street 5, 10 years, maybe longer, their physical age is 55 or their chronological age is 55. Their physical and mental age is 15 to 20 years older, which only underscores the truth of social determinants of health, that when you have access to housing and services, you really do have better health outcomes that are better for the person, better for the community, and cheaper for all these taxpayer-funded systems. Next slide. All right, so you might not want to know this, but this is this is the ins and outs, your crash course in all things Medicaid. So we're not going to start with what a state plan amendment is. We're going to start with what is a state plan. So your Department of Medicaid Services has a contract with the federal government, the Center of Medicare and Medicaid Services, CMS. It is the godfather of all things Medicare and Medicaid. And this contractual relationship with, oh, my slides are moving, between the Kentucky State Department of Medicaid and CMS. It's this formal agreement that stipulates who's covered by your Medicaid state plan, what care do they have access to, and how much you are paying for that care. So a 1915I state plan amendment is a formal process where you knock on CMS's door and say, we want to change a rule, we want to create a new benefit, or we want to change the fee structure. So the RISE initiative, as it is called right now, used to just be 4 years ago, the 1915I state plan amendment. It has been under development for close to 5 years, and it truly takes a long time to get to where we are now, which is the benefit went live last July 1, and we're focusing on building capacity in the system. So next slide. So here's some origin story. Your Cabinet for Health and Family Services charged Medicaid to think through how to beef up services and supports for folks with mental illness and or co-occurring substance use disorder. And then you see there additional actions below that supported, hey, we're recognizing a population of people that need additional services and supports. Now, here's another fun fact for you. Street homelessness, and I know Ray can give me an amen based on her work at the day shelter and Kathy at Wellspring, is 90% of people walking the streets, living on the streets, sleeping in parks, sleeping in buildings unfit for human habitation. 90% of them have a severe mental illness coupled with a co-occurring disorder. So as we dig into what this benefit is all about, it is perfectly aligned with working to end street homelessness by providing a reliable funding stream to scale the service side of supportive housing. Next slide. So you might be thinking, well, what does RISE stand for, Leah Warner? Well, it stands for Recovery, Independence, Support, and Engagement. And it is for folks with severe mental illness or co-occurring substance use disorder. So mental illness has to be in play. You can't just have a substance use disabling condition and qualify for the RISE initiative. And it's a unique partnership because the application, the state plan amendment came from your Department of Medicaid, but the administrator of the benefit is your Department of Behavioral Health and Developmental and Intellectual Disabilities. So CSH for 5 years now have been meeting with Medicaid, KHC, DBHDID, which always is a mouthful, on building the benefit, focusing on system alignment, recognizing that the Medicaid world lives over here, housing and services and homeless services lives over here, and the two worlds really do not work well together. So CSH is uniquely positioned, and you'll learn about this work in a moment, to help connect those worlds, to make sure that 90%, those folks living on the street of Louisville or Owensboro or Owsley County, have a path to connect to critically needed services and supports. Next slide. Okay, so you have to be an adult. You have to have a mental illness or co-occurring disorder. There is a comprehensive assessment that is done by our friends at the Department of Behavioral Health. This Inter-RAI Community Mental Health Functional Assessment Tool, which acts as a comprehensive interview. And the goal of the interview, of this battery of questions, is to really understand how one's mental illness or co-occurring disorder impacts their level of functionality, right? And there are these domains, and I wrote them down because I don't have them memorized. Your ability to function in society. So think about, can you manage relationships with your landlord, with your neighbors, interpersonal functioning, all different stripes of relationships. Are you able to manage them and manage them successfully on your own? Daily living and personal care. Are you able to function in that way on your own? Physical functioning, so looking at disabilities, and cognitive and intellectual functioning. So this Inter-RAI, Community Mental Health Functional Assessment Tool, also a mouthful, gets at, do two or more of these domains, are they impacted? Do you have a level of functional impairment based on your mental illness or co-occurring disorder that impacts two or more functional domains? If the answer is yes, right? That's what comes from this comprehensive assessment. Then you are eligible for RISE. The housing-related services components of RISE is for folks who are homeless, at risk of homelessness, a history of frequent institutionalization like a nursing home, or have experienced homelessness in the past 24 months. So when you add all of these factors together, coupled with our knowledge about street homelessness in communities all across the country, this benefit is intended to move the dial on the incidences of homelessness by providing reliable, steady funding stream to pay for the services. And if you remember at the start of this, I said, but for affordability, people wouldn't be housed, and but for services, they wouldn't stay housed. And since we're not about funding the revolving door back into homelessness, we really need to crack this nut about how to provide robust services that help people keep their housing, because all of the amazing outcomes that speak to why supportive housing is an evidence-based best practice, improvements in physical health, mental health, connection to families, connection to benefits, meaningful employment opportunities, only flow from being able to keep your housing. Next slide. So when we think about the principles that we hold dear at CSH about what supportive housing is, and the principles of RISE, they're beautifully aligned. We're all about connecting people to services and supports in their community. We're all about fostering independence. We're all about mitigating undue institutionalization. There are so many people who live in institutions who don't need to live in institutions, and they're incredibly expensive. And of course, we're all about meeting people where they are at. So these are the values that DMS and DBH, which I'm abbreviating for simplicity's sake here, came together and said, these are our foundational principles. Next slide. Okay, so you're like, what services are there? Pray tell. There's 10 of them. Drum roll. One more slide. There you go. Okay, so 10 of them. There's a lot here to unpack. So we've got assistive technology, transportation, medication management. They really kind of span the gamut. Next slide. At CSH, we're laser focused on tenancy supports, pre-tenancy supports, and tenancy sustaining supports, right? This is a beautiful case management catch-all of all things that someone needs to be able to find housing and maintain housing. And the reason a non-medical necessary benefit is such a win for the state of Kentucky is because when your state only has medically necessary case management, what your case manager has to do when they're driving Mrs. Smith to a doctor's appointment is talk about all this stuff to be able to bill for that unit of service. So this removes the shackles of medical necessity and provides case managers the breathing room to really meet people where they are at, to say, hey, you need help with budgeting. How are we going to prioritizing paying our rent first? How do you even know how to find housing? Do you understand your lease? Do you know how to request a reasonable accommodation? Without the shackles of medical necessity, we are freeing up the conversation for someone who needs access to supportive housing and the case manager providing tenancy supports to really attend in real time to what someone needs to be able to secure housing. On the other side of it is, oh, we're saying but for the services, people wouldn't stay housed. We are laser focused on housing retention to make sure we can get to all those amazing outcomes that come from housing stability. So once again, this beautiful catch-all of all the things that case manager can work with a tenant on. Do you know how to go to your landlord and be brave to ask for something to fix in your unit? Do you know how to manage conflict with a neighbor? The benefit actually pays for that time, right? This is a huge, huge win for the state of Kentucky. So we've been focusing on the tenancy support benefit because housing-based case management, as we call it at CSH, in supportive housing, is the keeper of the relationship, of the trust, of the information and referral to other community-based providers. And this provides a steady revenue stream to support that service. Next slide. Next slide, please.
Sorry.
So just another way to look at this full alignment between supportive housing core principles. We recognize and honor choice and self-determination. And for folks with mental illness, the greater sense of choice and autonomy, I'm the queen of my queendom, that people have, we see a natural decrease in behavioral health symptoms. So that's already a win when we really honor and value choice. It is choice of providers. It's choice in where you live. You have the right to feel safe in your housing. You have a right to feel safe in your community. You have a right to not be cost burdened, spending more than 30% of your income on housing. You have the right to be one of many. The ironies of homelessness is people are uber visible. You could probably picture the person who's on your exit ramp home, who's panhandling every day at 5:30. But at the same time, people are hyper invisible, right? And being the gift of one of many, the gift of anonymity, like I can just go and be among people, is such a gift. And then we value people's choice to fold in whoever they want to fold in on their journey to stability. Next slide. All right, so we've talked about tenancy supports, in-home independent living supports. We know our housing-based case managers focus on health, housing, and income. And housing means, are you keeping your unit clean? Are you paying your rent on time? Do you know there has to be a safe way in and out? Do you know how to use your thermostat? Things like that. There's also personal care, cooking, all of these things. Well, some people need a little bit of extra love in this department. Well, there's an extra benefit, in-home independent living supports, that can be coupled with the tenancy supports. And then there's supervised residential care, which is somewhat akin to a group home. 3 unrelated adults living in housing where they each have their own bedroom that is staffed, not staffed by a clinician, but staffed, right? So these are the 3 housing related services that I was talking about, going back to that map with 17 states that are really helping move the needle on Kentucky building up the capacity that at the end of the day will help reduce incidences of homelessness. Next slide. So this is also a huge win. Supported education and supported employment are evidence-based best practices, which is a long way of saying it's been studied and proven to work. IPS, individualized placement and support. Both of these interventions are recognizing that folks with mental illness or co-occurring disorder need help getting an education and staying in school. The parallel of that supported employment is people need help getting a job, identifying skills, building skills, interviewing, resume building, all the things, and then they need help keeping that job. This benefit, these 2 benefits under the RISE umbrella, pay for that support. So you can have an organization that's like, yep, sign me up to be a supported education provider and a supported employment provider. A person who meets those qualifications through that comprehensive assessment says, yes, I want to work with this provider to get a job, or yes, I want to work with this provider to help me go back to school. So also huge wins for the state of Kentucky. Next slide. So these are additional services under the RISE umbrella: assisted technology, transportation, medication management, and then planned respite. So it is, hopefully you see, it is incredibly robust, right? We have 10 unique services and supports that are naturally aligned, well, not naturally, are planned to be aligned with folks experiencing homelessness, folks at risk of homelessness, really thinking about that street population that disproportionately have mental illness and co-occurring disorder, and really touching on all the services and supports they might need to resolve their homelessness. Next slide. Oh, I cut that. Move on. Okay, next slide. So Medicaid has put forward a provider journey. So St. John's is doing the due diligence to become a Medicaid biller, a RISE provider, and a participant journey. This literally is all the steps. Now, the truth of the matter is, pivoting from being a homeless service provider to a Medicaid biller and a subsequent RISE provider is a Mount Everest to climb. It changes all aspects of your organization, from fiscal, admin, programs, and IT. It is a culture shift unto itself. But our Medicaid guru at CSH says, yes, the first mountain is just that. It's a ton of work to become a Medicaid provider, a RISE provider. But each subsequent benefit that you decide to offer is a puddle to jump. So there's something to be said for the long game. But guess what? We're going to talk about you all, providers in the field, having the support they need to be successful in this work. Next slide. The CSH Medicaid Academy. So this past May, we graduated 17 teams, organizations all across the state of Kentucky on the Medicaid Academy, which is a comprehensive training series catered to homeless service providers. But for Kentucky, we had community action agencies, we had Catholic Charities, we had homeless service providers, we had mental health providers come to us to attend. Next slide, please. 6 training sessions that go through all pieces and parts of Kentucky Medicaid, and specifically the RISE initiative, from provider enrollment, participant enrollment, staffing, and budgeting. Because the truth of the matter is, if you don't bill Medicaid, you're relying on COC funds, maybe federal pass-through, state dollars, philanthropy, grants, and it's a hustle every year. You are hustling, hustling, hustling. One of the values of billing Medicaid is, once you climb that mountain and you're approved and you've got your documentation and billing moving at a good clip, you really have this reliable funding stream that takes the pressure off this annual hustle. Policies and procedures, documentation and billing, and quality compliance. Next slide. You might be wondering, why are you talking about an opportunity that has already passed? Because we're hosting another one in 2027, starting in January. So the beauty and the lift for my team, the internal Kentucky Medicaid Academy team at CSH, is we tailor all of the curriculum to Kentucky Medicaid and the RISE benefit. So no given provider has to create everything from scratch. We have a tailored service budgeting tool. We have a tailored policies and procedures template, a billing guide, et cetera, et cetera. So we do all of this behind the scenes work. We do ongoing technical assistance that we're about to launch with our recent graduates to do the hand-holding, to provide the platform for Q&A as folks navigate the complexities of becoming a Medicaid provider and a RISE provider. Next slide. So why should your agency sign up? Well, ask Ray. She'll tell you why. So CSH is a beautiful intermediary with supportive housing as our North Star. We know housing and we know services, and we know out in the ether, these two worlds don't talk, but we talk. We have that subject matter expertise internally, so we can help broker that divide. We know the needs of our tenants. We know folks are coming to us with a higher acuity of need. And I know there's an amen out there on all the blank logins. Having a reliable funding stream and such a robust array of services as we deal with higher acuity folks is a win. And we need to expand the services that are available to our folks across the state of Kentucky, and this is a way to do that. Next slide. So you walk away with a whole bunch of things that actually help you navigate the complexities of becoming a Medicaid provider and a RISE provider, from work plans, the tools and templates. I already referenced subject matter expertise, that's on call, office hours, individual team TA, cohort TA, peer sharing. So there's a lot of richness that comes from the participation in the academy. Next slide. This is the last one, people. So we can take up to 20 teams in the next cohort. There is one in-person session in Frankfurt where we talk about all things budget. It's 5 2-hour virtual sessions. There's office hours every other week on the off week of the virtual sessions. We're going to start at the end of January, wrap up in May. Individual and cohort style technical assistance for the teams, and it's free, courtesy of Kentucky Housing Corporation. They see, they're the keeper of the balance of state continuum of care. They see what homelessness looks like in your state. And this suite of benefits really will help scale supportive housing and address the growing tide of homelessness in your state. So if you're interested in learning more about this opportunity, if you want to get on my list of interested providers, my contact information is on the next slide. And with that, I'm happy to answer any questions right now. But feel free to reach out anytime.
Leah, thank you so much for that really great presentation and information. It's a lot of dense material to hear at once, but it's also amazing how much you and others have given thought to what this program could mean and do. So thank you for sharing that. And I just saw in the notes that Kathy Dobbins said West Spring was approved as a RISE provider yesterday. For you,
Kathy. That's huge. And
that
that's
is
great
exciting.
for Louisville.
No, that's great. And we're excited about these new services, which will be fantastic for a lot of our HUD homeless programs. Especially, but across the board, I think they're going to be great for the population we serve. I would say one thing though, Leah, Medicaid, it's not just smooth sailing.
No, I know.
Because we have been a Medicaid provider of other services for years, and we have to work with the MCOs. People have to hit their budget. If they don't hit their productivity levels, you deal with all of that stuff, which is not easy.
True.
But one nice thing about this program, the RISE program, is actually you don't work with MCOs. You work directly with Kentucky Medicaid, which, in my opinion, is a great thing.
It's a huge win. And I didn't go there because I thought that might be too weedy, but I'm glad you elevated it. Working with MCOs is its own different beast. And when
Yes.
the state decided to go fee for service, everybody was like, oh, thank goodness. Because you have to
Yes.
build relationships with all the MCOs, and there's what, 7 of them in Kentucky, which is a whole thing. So this makes it as complicated as it is, honoring Kathy's well-thought input. It does make it easier only having to go to the agencies, go to, DMS and DBH.
Definitely.
I'm so
You know
happy
what?
to hear that, Kathy, though. Congratulations.
Well, thank you. Appreciate that.
Ray, did you want to chime in on anything? You all have been part of the Medicaid Academy, and
Yes, happy to. We have not made as much progress as Wellsprings, but we have our a virtual visit next week where we will do our I think it's our formal kind of interview just to make sure to go over our policies and make sure our space is set up. We are enrolling to provide Tennessee supports only. But looking forward to it, right? It's a really good opportunity for us as an agency. The questions, right, that I still have are around what the participant, right, experience looks like. Right, I guess we've not gotten that far, right? But I do have a lot of questions and just curiosities around what it'll actually look like getting participants enrolled, what the assessment piece will look like, right, and coordinating the state required assessment with all the other assessments that participants in any
Yeah.
federal funded program have to do, and just the still lingering questions around the availability of the assessors, right? That is going to be a big part of our ability to actually work the program, is getting the state assessors connected to our participants. And I think at some point, right, we said there were maybe 14 for the entire state. So questions, right? I guess a point of advocacy, right? Anything that we can do to make the assessments more accessible, right, to our participants will, just make it all easier to manage and actually get some of those revenues coming in and people connected to more services.
So to Ray's point, there's 5 assessors.
5, okay. Woo.
5.
I said
You were
14.
striving for 14,
I was being hopeful.
We're at 5 right now, holding steady at 5, unfortunately. But the interviews are taking less time than they originally thought. So Ann Holland, who works with DBH, said they're like, 3 hours. Now, to Ray's point, the people we work with are assessed to death, are intaked to death. And if we put ourselves in a tenant's shoe, like, why are you asking this information again? Right? It's exhausting. So how we message and position ourselves to recruit someone to entertain being an approved RISE participant, there's a lot of finesse that goes into that we'll be navigating those waters right along with Ray and all the other teams that went through the Academy and Future Academy, because it's real. It's like, why do I have to do this yet again? So it's definitely been an issue that's flagged to really help scale this and help this initiative be successful.
Yeah, and I would add that the assessments are supposed to take place in the community where that person lives. So, that was a good thing, but you can see how that would make things move a little bit slower, making that piece happen. First there's getting in line to actually get assessed, and then there's lining it up to get that assessor into the community, connected with the client, which will have its own set of challenges with this population. But
for sure.
It's all good. It's all good. And then there's conflict-free case management, which is another issue we won't go into because it is 2 weeks.
I cut that slide on purpose, Kathy. I'm going to break people's brains.
Right. I get it.
We're figuring it out, though. There's lots of smart
Absolutely.
people around the table figuring it out.
And the note that I would end on, right, is just being grateful for KHC's continued investment, right, into this work and figuring out new ways to address some of the barriers, right, and the gaps in specifically behavioral health, right, and mental health care for people that we serve, and helping us, create different revenue streams, right? Even if that stream is a little faulty right now, we got to try. And so just grateful for KHC's continued investment and support. So thank you. And always your tutelage, Leah.
If I had one more comment, and this is me, I promise, it's that because this Medicaid service focuses on really highly disabled individuals, I hope that it will be safer than the broader Medicaid program at the federal level and state level, for that matter, where we're bracing for cuts after the big beautiful bill goes into effect.
I mean, we're tracking, federal changes to the Medicaid program and have been breathing small sighs of relief on the carve outs around work requirements for folks with disabilities, et cetera. But we're definitely on the pulse of it. Because nothing is fully guaranteed.
Right. Well, thank you for that, Leah.
Anything else, fine people? I think we're good, Lisa.
Thank you so much.
Well, thanks everybody. Have a great rest of the week.
Thank you.
Back to quarterly reports.
Good luck.
Thank you.
Take care, everybody. Bye-bye.
Bye.
So next on the agenda is Kelly Reynolds with updates to the weatherization program. Is Kelly here?
Yes. Hi, everyone. Weatherization is a moving target, as always. I feel like that's always my message over the last probably 18 months, but it's still the case today. So I'm going to talk today to you about the DOE state plan. We talked about this in April, but there's more updates. So we'll talk about that and then other legislative updates that are going on just to let you kind of know where legislation is for weatherization. So we'll go to the DOE state plan. When we met in April, we passed a motion that if the plan was released before our next meeting, that the officers could look at the plan and approve it. So just to refresh your memory, this week we have quarterly reporting due for deadlines for both our IIJA and our formula grants, but also the state plan was released by DOE on July 9th. And funding is appropriated, but as you know, funding is appropriated through September 30th. So by 2 CFR 200 guidelines, when federal agencies issue grants such as this, they have to allot at least 60 days for response. So they are allotting 60 days, which would get us to September 7th. However, so that's when the state plans are due. However, if we get it in September 7th, they will not have enough time to get it approved before September 30th, which is when the funding expires. So what Department of Energy is telling everyone is we really need you to get that into us before September 1st. So it's a quicker time frame. Now we were kind of like trying to plan ahead as much as we could. But DOE did change a few things in the application guidelines. It's not terrible, but they have moved sections around. So we're having to go through section by section by section to make sure that what we have written in that section is what they're asking and it doesn't belong in a different section. So it's been a little bit tedious. And the budget for the DOE state plan is always horrendous. It takes me days to do it because there's something called rollover dollars. So whatever we don't spend, we have to project out how much do we think we're going to have left over, and then we have to roll that in and build that into our budgets. And when I talk about budgets, down to pens, I have to allot for every penny down to pens, pen purchases. So it is horrendous. All right. So next slide. So I'm going to give you the updates of where we are. And so as we discussed in April, we are increasing our contractor reimbursement from $100 a day to $200 a day. That is to hopefully get more contractors in the realm of weatherization work. And what that means is when they go to training, we can reimburse them $200 per day per employee that they send to training, up to $1,000 a week per person. So we are trying to reimburse them for any wages that they're having to pay employees by coming to training. That's the hope, wages and staff and salaries and benefits. We are increasing our minimum wage payment. So we have a minimum wage set for positions in weatherization, the retrofit installer technicians, crew leaders, quality control inspectors, and energy auditors. And we base that minimum wage on a wage study that NASCASP, our membership organization, conducted nationally in 2024. All of our subgrantees in the state participated. So whatever the average is for those positions in the state is what I set the minimum wage at, because guys, it's really hot going in an attic on a day like today. So we want to be sure we're paying people as well as we can. DOE actually increased the health and safety budget from 15% to 20% this year. So that's taking a little bit of a rework. We had rationalized for 17% and been approved at 17%, but now it's up to 20. Definitely needed. It's a great change, but it just means a little bit more changes in the state plan than we had anticipated. We talked about this in April. We allowed for replacement of inoperable hot water heaters in our health and safety plan. We also have included in this state plan criteria for doing multifamily projects. So we have had several subgrantees approach us wanting to do multifamily projects. And when we look at their capacity, it's a bit limited. So we established in November, here are 6 criteria that you need to meet in order to do a multifamily project. And I will give you the reason behind that. When we're looking at some of the larger multifamily projects, 60, 80 units, and we have a subgrantee that they have done 11 jobs all year and they're wanting to do 60 or 80 jobs, we're not sure how they've got capacity to do that when they've not been producing those numbers previously, number one. Number two, we also have to ensure, so we have it written in our policies, and it's been in there since we took the program in 2009, that a third of their unit completions, not more than a third of their unit completions can be for multifamily projects. So if they want to do a 60-unit multifamily project for a year, that means really they need to be producing 80 units. So do you have capacity to do that? So that's kind of what we're looking at. And I just wanted to throw that out there. There's been some controversy amongst our subgrantees over these 6 criteria. They are very measurable. It's easy for them to know if they meet them. And we have built in a waiver option. So maybe if they meet five of the 6, could they do a waiver, and we could waive them in order to let them do that to approve. So we've built that into the state plan. And that was also approved. Those criteria were approved by DOE in our low-rise priority list submission that was approved in March. Those criteria were approved as part of that policy. So this shouldn't be a hard sell to DOE at all. We are going to limit admin. So we have a number of subgrantees that in their IIJA funding, they are almost out of admin, but they have a lot of program dollars left. So their admin expenditures versus their program expenditures are kind of out of kilter. So we're trying to just mesh that back up and make that equal again. So we're going to start limiting admin based on a percentage of their expenditures. More so because if we have to reallocate those dollars, we need to be able to reallocate admin, and we don't want to get to a year down in the grant and now they have to pay some admin back because we just don't have enough admin to reallocate with the dollars, is essentially what that's to do. It's kind of to protect everyone. We are replacing a subgrantee. The Bluegrass Community Action Partnership has decided to give back their weatherization contract that was effective June 30th. So on July 15th, we issued an application to the network to replace them as a subgrantee. The application is due August 7th. That will be part of this state plan submission. It will be in our public hearing on August 13th. Now, this is a bit of a change even from yesterday when I sent these slides to Lisa, Lisa, 2 o'clock in the afternoon. So you can kind of gauge on how much things changed with DOE. So we had changed our retrofit installer training, RIT, and crew leader certifications based on what BPI told us, which BPI, which is our which is the certification agency for weatherization trainings, they had told us, hey, we're not going to have official certifications for these two positions anymore. So we said, fine, we'll keep training on them. We notified our accreditor, our accrediting agency, which is NREL, hey, BPI is not going to do these certifications anymore. NREL didn't know. So NREL had to go research. They came back today, this morning, and said, so we know they're not going to issue the certifications, but you are accredited to do them. So you still need to teach them just like if they were. So we were going to kind of change the curriculum, to make it more Kentucky specific. We cannot do that. We have to go back and teach it like we were teaching it. It's fine. Just know we were going to change that. Now we're back to, what we were originally doing. So no change. That's what that's about. Are there any questions on those changes? This is what will be presented at the public hearing. The documents will be available on Thursday because they do have to be out at least 10 calendar days before the public hearing on August 13th. The public hearing is being advertised on our website and in our egrams. If any of you want to register, you're welcome to do that. But the documents will be available on Thursday morning. Any questions about that so far? Okay.
I'm sorry, I do.
Sure. Yeah.
And I'm just trying to understand, right, how the department operates, I guess. What the subcontractor that you mentioned, Bluegrass Community Impact, why did they end their contract? Just curious.
Bluegrass Community Action.
Action, thank you.
So weatherization is a super challenging program. This is not easy. It is very heavily regulated. And because we are so heavily regulated by the Department of Energy, we also have to heavily regulate our subgrantees. And so at the end of the day, I think they felt like it had become too cumbersome of a program. And I get it. I do get it. It's very technical. And if you don't do things right, you have financial paybacks. And I think, their second year of financial paybacks and findings, I think they just decided this just wasn't where they wanted to spend their efforts.
Okay. And were they like a contractor? Were they doing the weatherization work, or were they a training entity? I wasn't
Yes,
clear
so
on
all
that.
of the subgrantees are contractors actually doing the weatherization work. The
Gotcha,
training
okay.
happens through the Residential Energy and Efficient Center that is actually housed within KHC's departments.
Okay, very good. And I guess I'm curious about that relationship, because if I remember correctly, in the last meeting, you had also noted that there were so many million, maybe $50 million that was unspent in the IIJ funds because of the inability to get contractors, right? Is that?
That is correct. So we have 51 million in IIJ funds. We've spent about 20% of them. And I'm just working on the numbers on this new state plan. We are awarded about $7 million. And it looks like from last year's grant for rollover, we're going to have right now we're projecting about 3 million. And that's a whole nother situation. So that grant ended June 30th. However, DOE also on July 7th, trying to think of my dates, on July 7th, they released no-cost extensions to all 50 states.
Mm-hmm.
We received ours on July 7th, and we received an extension through December 31st. So we're like trying to kind of throw a dart at the dartboard as to how much money we will have left.
Mm-hmm.
Right now, we're projecting 3 million through September 30th, and that's the number I'm working with.
Okay.
So that's where we are.
Okay.
Yeah, so it is a lot of money. So at the end of the day, we have probably roughly 40 million left in IIJA funding. This grant with our rollover will be somewhere around 10 million. So yes, we are looking at $50 million. That's not including the LIHEAP money that we braid with both of those funding streams. LIHEAP money usually is around 7 to 7.5 million allocation for the year. But we usually can spend it pretty faithfully. The DOE money is a bit a bit harder just because there's so much of it.
Mhm.
But yes, contractors we for sure need. About half of our subgrantees who run the program work with crews, and about half of them run with contractors.
Mhm. Okay.
And Bluegrass was one of those subgrantees. They kind of ping ponged back and forth. They've done it with crews, and then they float to contractors, and they just haven't found a good mix of how to get a lot of jobs done.
And some of these changes that you're making to the plan, like increasing the reimbursement, right? These are things that we are hopeful will incentivize more
attract
contractors to
Yeah.
stay on
So
board.
one of the things, I guess up until about 4 or 5 years ago, we did not reimburse them for training. So we could pay for their hotel expenses, their meals, but we weren't reimbursing wages and, salaries and benefits. And that was one of the complaints we were hearing about. Well, but we can't, like, we're sending them to training for a week, but they're not getting any work done. So they were actually losing money, right, on that deal. So this is to try to help offset those costs so they're not essentially losing money by having employees in training.
Okay. Thank you for allowing
You're
me
welcome.
to
Great
just
questions. All
unpack
good
some of these
questions.
things. Is there a list? Is there like a published list of contractors, right, for the weatherization program on the website?
Yes, right now, and it will be listed in that state plan, but it is on our website on the weatherization pages. It's called, I think it's on our main pages, but the state plan, the 2025 plan is on there, and it's the annual file is what you're looking for.
Okay,
Yep.
thank you.
And just an FYI on multifamily, we do have 2 subgrantees in the state that do multifamily projects. One is multipurpose out of the Shelbyville area, and then we brought in a subgrantee out of state. They're actually out of Chicago to help us build our capacity to do multifamily. So they're acting as a subgrantee, but also kind of training us as we go. So hopefully within the state, the idea is that they are here for a short time, so we can get some subgrantees kind of up to speed on this is how you do weatherization in multifamily projects, and then CETA can kind of pull out. But that is kind of like a long-term, short-term solution. Yeah. Any more questions? All good questions. All right, next slide. So this is our state planning process. Again, we'll have the documents on our website by July 30th, which is Thursday. We have a public hearing on August 13th. It is a virtual public hearing. The plan is due on September 7th, but we have to have it in prior to September 1st. So I'm shooting for that last week in August. If I can get it done the week before, I will. But I'm speaking at a conference, a weatherization conference in Phoenix that week. So I don't know how much time I'm going to have to get that state plan in, but we're going to try to do it if we can. So what I'd like to do, because the state plan isn't ready and we're still trying to plan, and all of this happened in the last 2 weeks, is use the motion that we made in the April meeting, which is to have the officers approve kind of what that draft state plan looks like. So that's kind of, I think, the best approach at this point, because we won't have another meeting before I have to have it submitted. So are we all thumbs up on this? Okay, perfect.
Kelly, do you need a motion on that, or you're just proposing to use the former motion?
I'm just proposing to use the former motion.
Gotcha.
Yeah. Okay. All right. I think we're ready for the next slide. So any more questions about the state plan before I kind of switch gears to legislative? Okay. All right. So to let you know, we kind of talked about this a little bit at the last meeting, and I will talk about what legislation is out there, but I do want you to know and update you on congressional meetings that I've had. So in the past 7 months, I have met with all the representatives and all of all of our senators regarding just education on weatherization. I'm meeting with them in conjunction with a lobbyist who's representing NASCAS and BPI on weatherization, but I'm just kind of doing, this is what it looks like in Kentucky. So my most recent meetings were with Representative Guthrie's office and Representative Rogers' office last week. Representative Rogers' office was very instrumental in getting us our no-cost extension as quickly as we did. We did receive it before other states who had actually requested it. We hadn't even requested it. DOE did a blanket, which I found out last week from DOE was probably our best approach to not request that in any case. So Rogers' office has been really supportive of weatherization. So we did just want to do a kind of thank you to them. So I met with their office, but then we went and met with Representative Guthrie's office, really to just kind of update them. They were not aware that DOE had not issued those application guidelines timely enough to get that money out before. So we were supposed to start with that new money July 1st. Representative Guthrie's office had no idea that DOE had dragged their feet on that. So they were very thankful that we educated them on kind of our timeline and what that meant. So that's where that's just kind of the messages that we had. Otherwise, we shared success stories. Here are the challenges. Here are the things that are going really, really well. Weatherization turns 50 this year, so we have our 50th anniversary of weatherization legislation. So last week, NASCAS had a big event at the Rayburg building. They invited all representatives, so all the House members, all the Senate members, and their staffers to a breakfast and a celebration. Representative Tonko, who is out of New York, spoke at the event. He is a big proponent of weatherization and does a lot of the sponsoring of bills. But it was actually good. There were a lot of Senate staffers that came over from the Senate building to be a part and participate in the meeting. So that was good. I was asked to speak at that event, which was really exciting. And I just shared one of our beautiful success stories, which I shared in April. I think that it was going to be a video. We actually have that video now. If it's okay, Lisa, I can send you the link to send out to HPAC later, if that's all right. It is an absolutely beautiful video, but get the Kleenexes because it's a little bit of a tearjerker. But it's a beautiful success story with a man out of London, Kentucky. So that's kind of what that event was just to say happy anniversary. So that's what's going on with those congressional meetings. And then for legislation, which is on the next slide, there hasn't really been any changes in legislation. We are still where we were back in April. There's really been no movement. Guthrie's office last week did speak to the lobbyist about that they're still, supporting the legislation, but they need it called to the floor. So they just recommended that he speak with the senior leadership in the House. And then Senate's the same way. There is a bill that's in the Senate right now that would kind of mesh up HB 1355, like that ACPU, kind of mesh all of that together to get them to start like looking much the same. So that's really the only update that there is. And they're all bipartisan in nature. So all of these have Democratic and Republican support and sponsors. Any questions about that? All right. Thank you all so much.
Thanks, Kelly. Looks like next up we have KHC updates with Wendy Smith.
Yes, thanks so much, Anne, and good afternoon, everybody. I'm just going to update you all on two areas. One, legislative updates from the Kentucky legislative session that happened earlier this year. And then the second thing is a new mortgage product that we just released yesterday, and we're hoping to grow in possibly multiple ways in the future. So let's go to the next slide. So the quick way is to say a whole lot didn't get passed, but a whole lot got proposed. When I'm on a optimistic wave, I just like to focus that a lot did get like a shot, but not a lot actually passed. So I'm going to share with you a lot of what didn't get passed, and I will highlight the things that did happen. So what did not pass is there was a proposal to modernize and price index the Affordable Housing Trust Fund fees. So the State Affordable Housing Trust Fund is paid via a recording fees when folks record a mortgage. And the proposal was to effectively triple those fees, but they have not changed since 2007. So they're almost 20 years old. And whenever you put a flat dollar amount in legislation, that number gets really old and outdated really quickly. So the proposal was to increase them and then tag it to the consumer price index so that it could automatically go up over time. That didn't make it. It got a lot of opposition from home builders and realtors who just don't want any fee no matter what it is. The other thing is the governor proposed a major increase to the State Affordable Housing Trust Fund in his proposed budget. You could view that as more aspirational than anything. The legislature did not approve that. They did make a small appropriation to it, which I'll talk about in a second. Next slide. There are many, many other things that housing related that did not pass, but I thought I would talk about most of them as kind of rolled up in this Senate Bill 9, which was kind of a housing omnibus bill, which is where many things that either were already proposed in this session or were about to be got rolled into one giant piece of legislation at the very end. And it had some really promising elements, some things that we really supported, even though they weren't, funding to KHC. They were the creation of some residential infrastructure districts or development districts, a lot of laws around faster permitting, and that if local areas couldn't get inspections done quickly enough, then builders could use third-party inspectors, narrowing who can challenge zoning changes. You have to basically be an adjacent neighbor. You can't just be someone who lives, a couple miles away and challenge a zoning change that might allow for affordable housing or more dense housing. It did some other zoning and development reforms also, and limits on local regulations to housing. One of the things that was kind of viewed as a poison pill, which made a lot of folks not vote for this, is that there were kind of at the last minute slipped in protections for short-term rentals like Airbnb or VRBO. It would have basically made it so that local governments could not regulate them or put moratoriums on them. And that just made it hard for a lot of legislators to vote for this overall bill because of that element. One of the big things that I really would have liked, and I know that the Coalition for the Homeless in Louisville pushed for this a lot, was automatic expungement of evictions that were dismissed in court. I really didn't know this until a few years ago, but any eviction that is filed is on your record forever, whether or not you were actually evicted or you settled with your landlord. And if you're a minor who is named on the lease, it might go on your record as well. And so this is a permanent kind of blemish. If you go through bankruptcy in what, like 7 years or something, it goes off of your credit report, but this eviction filing never does. And we had a lot of support for this automatic expungement of dismissed evictions, meaning if you worked something out in court or the judge decided it should be dismissed, it would go off of your record. Anyway, this did not pass, but we do have some limited hope that something along these lines might get another chance in the next legislative session. So fingers crossed on that. Next slide. What did pass? There were several promising things that did pass. One is, and they didn't call it this, but this is how a lot of people know it, a Yes in God's Backyard piece of legislation, which basically said that if you are building fewer than up to 24 units of affordable housing or shelter on church-owned property or religious organization-owned property, that you don't have to go through rezoning. You can just go ahead and do it. So that's a great thing. It'll be interesting to see how much that changes, development patterns. We will have a session on this at our conference. The next one we will also have a session on at our conference, which is revisions to the state historic tax credit. So our state has a really generous tax credit program. It's different. It's kind of akin to the historic one, but different. And it basically, they've created incentives to do housing and to do affordable housing. Basically, you get more in tax credits. This runs through the Kentucky Heritage Council. Craig Potts is on this advisory committee. He's with us in the meeting today. Anyway, KHC has a role in this. It's a small role, but we have a role in supporting the Heritage Council in verifying that the projects are going to be charging affordable rents, that they are income qualifying folks. And so we will be reviewing projects on the front end and then also for the 5-year compliance period. I do think this may really incentivize a significant number of housing, of historic renovations that do include housing. And for at least 5 years, those units will have to be affordable to folks at 80% of area median income and below. From a supply standpoint, I'm really interested to see what happens. And then the last one was there were some appropriations, not just to KHC, but to housing. One is $10 million, $5 million each year in the 2 years of the budget biennium that would go into a residential infrastructure revolving loan fund. There've been some line item, really word by word vetoes by the governor. We don't know exactly what's going to happen with that, but 10 million was appropriated. And then for the State Affordable Housing Trust Fund, $2.5 million per year, for a total of $5 million, was appropriated in one-time dollars to the Affordable Housing Trust Fund. So that's a nice increase. We receive roughly $4 million a year in fee income. So it's a nice increase. Is it enough to like move a giant needle? No, but we'll take it and we'll work with it. And was that my last slide on the legislative session? Oh, and just to let you know what we plan to do with the Affordable Housing Trust Fund. Percentage-wise, it seems like a big increase, but when you consider how much development costs have gone up, $2.5 million per year is not a radical increase. We will really deploy this through our existing multifamily and home ownership and home rehab repair programs. And we have some funds left over that we are carrying forward. We also do what we call forward allocating. So future anticipated funds, we go ahead and allocate early because a lot of our projects take time and we don't want those dollars sitting around for a long, long time. So we will have an increase from about 5.7 million in fiscal year 26 to a little over 9 million in fiscal year 27. We're happy to have it. I will say we need lots more either in this or some other vehicle to accelerate housing supply, but we will take it and put it to use. I'll pause there in case anyone has questions about legislation or the trust fund. We do have a separate advisory committee for the trust fund, and they met this morning. So we shared very similar information with them. Okay, next slide. So I wanted to share with you all, yesterday, KHC opened up, we launched what we're calling our Shared Appreciation Mortgage Program. We're doing it with $10 million of somewhat discretionary funds that we have. It's a pilot. And how it works is the SAM mortgage, Shared Appreciation Mortgage, is a second mortgage where the first mortgage, a home buyer who earns 80% of area median income or below, gets a mortgage through one of our bank or mortgage company partners. We have partners all over the state. So they get their first mortgage and KHC funds that first mortgage. It's just a traditional mortgage. But then we also fund a second mortgage of up to 25% of the purchase price / appraised value. So 25%, what's that do? That gets you out of private mortgage insurance, right? You don't have to pay PMI. It can often get you a better rate. And we don't make the home buyer pay on that second mortgage. There is zero interest and no payments, but when the buyer sells the house, does a cash out refi, or at the end of the 30-year mortgage, then our mortgage is due. And what we want back is our original principal and our proportionate share of any appreciation. So we get, if we put in 25%, we get 25% of the appreciation. Limited to that, no more. The home buyer would get 75% because they took out the mortgage on the 75%. We would then recycle that money back into more mortgages, more shared appreciation mortgages. So we are piloting this. We're trying to see how it goes. We opened yesterday. We've already had at least 3 homes that I know of. 3 loans have locked in. We are limiting ours to new construction only. Part of what we're aiming to do is to incentivize home builders to build smaller scale affordable homes, and we're going to come in with this second mortgage to make the appraised values are just so dang high. It's really hard for a moderate income home buyer to access it without that second mortgage. So we're trying to give folks access to building, that appreciation and that equity. We're going to get a share of it. We're not going to get more than our due share, but we are going to get a share of it. And we're going to pilot this. And we've been talking with some other municipalities to see if they might be interested in us administering like a program just for their jurisdiction to do this. So we're interested to see how it grows. We'll have lots of sessions at our conference about this. Next slide. I'm not going to go through all of this, but this is kind of to just help you all understand, like the first house on your left-hand side is the financing, like when someone does a mortgage with the shared appreciation mortgage. That second shared appreciation mortgage is in green. And what you see is then if over time the home increases in value, in this case, we're saying it's increasing from 300,000 to 350, what happens then? Who has what share of the growth? And what you see is there's still the first mortgage balance. There's then a payback to the shared appreciation program. And then the home buyer also has equity that they would get even after paying off whatever was due in their mortgage. So we're aiming for this to be incredibly fair. We're doing specific homebuyer education just on this. And every year we will send the homebuyer a statement of kind of their estimated share of the appreciation and what we estimate that to be, so that they're not blindsided when 10, 15 years down the line, they sell their house and they feel like they didn't understand. And when a loan approaches the 30-year maturity, where they're about to pay off their first mortgage, we will probably begin sending them monthly statements so they know what's happening. And if someone gets to the 30-year mark and it's just not possible for them to pay us back, now I want to make it clear, it's really rare for any of our loans to get to 30 years. Most folks refi or move or something. But if it gets there and they cannot just pay it back in full, we would then basically modify our loan for them to pay for 10 years, and then they will have paid it off. But they would not have a first mortgage payment at that point, right? They will have paid off their first mortgage, and so they would just finish paying our amount off, and then they'd own the home outright. We just want to recognize that some folks might get to 30 years and not be able to pay it back, and we wanted to be ready for that. Next slide. This is overly complicated. This made sense to me yesterday, and it's a whole lot today. But just to give you all an example, if someone purchased a home for $200,000, but their first mortgage was $150,000, 75% of that, and we did the shared appreciation loan of $50K, and then if over time they went to sell it and the home had appreciated up to $250,000, then the overall appreciation, of course, is $50K. It's gone up in value. KHC's share of just the appreciation is 25%, so $12,500, and the borrower's share is 75% of that appreciation. So the borrower gets $37,500 of the new appreciation. And so then KHC would need to be repaid our original $50K plus the $12,500. The buyer would then have the proceeds of the sale, their $150K plus the $37,500 in appreciation. So what we're aiming to do is kind of do it in a way that lets us revolve the money and let the money earn a little bit over time. But look, if the house doesn't appreciate in value, KHC doesn't get any. We might just get our original amount back, right? But we don't get any. So we're not trying to do something that's predatory, but we're trying to kind of get a proportionate share back and revolve it for another home buyer. Again, this just launched, and it's a pilot. We're aiming to see how it goes. And that concludes my updates. Thanks, y'all.
Thanks, Wendy. Does anybody have any questions for Wendy?
Wendy, what would the SAM homebuyer education look like? Would it just be a kind of run-of-the-mill HUD approved counseling course?
No, we require that on a lot of things, but this is actually a separate SAM course. It doesn't take a long time, and eHome America is going to administer it for us. So it's an online course. It does involve answering like some quiz questions at the end to make sure folks at least understand the basics of how this works. But it is a separate thing. We want to make sure folks get the course, get emailed a PDF of the slides, and certify that they understand what they're getting into. We don't believe there's anything predatory about this, but we do not want folks to feel blindsided by it.
And how soon will you have like kind of marketing materials for like developers that are in the process of now? Because we've got two.
Yeah,
new directions
email me.
recently.
I'll send you our single family. This is going through our single family mortgage shop. And
Okay,
so I'll
okay.
get you connected with them, Michael.
Yes, thank you. Thank you,
Yeah.
Wendy.
Yeah.
Yeah, this sounds like a great idea. Would you reiterate why why it only is eligible for new construction?
Sure.
You
That
said.
is partly, we know that $10 million is going to go up in smoke really, really fast. That's part of it. But also we are trying to desperately find ways to incentivize getting more supply built
Just
for
more
moderate income folks. And so right now within the just marketplace of home builders, outside of our nonprofits, but just home builders, they're not building many homes that are affordable to moderate income folks. And so what we would like to do is demonstrate that this works and demonstrate that it's worthy of more investment, so that we have this like pipeline that makes it so that the home building industry will bring more units to market that are affordable to moderate income folks.
I gotcha. Yeah, and you spoke to my curiosity, because I'm like, if the goal is to focus on people at 80% AMI, how many of those individuals are doing new construction?
Right.
But the goal is to make it new construction accessible to them.
We know we could move faster if we allowed for existing homes. And I will say some of the municipalities that we're talking with would want to use their funds for existing homes as well. So it might take kind of different forms depending on who's investing in it. We felt like it would go up in flames and be utilized like in 2 days if we did it on existing homes.
Yeah. That makes sense. Thank you.
Okay, thanks again. Do we have any other announcements? The Kentucky
Hey,
Affordable
I've just
Housing
got
Conference?
one. Oh, sorry about this. I've just got one outside of what was mentioned on August 26th. Some of you attended our solar demonstration in London back a month and a half ago or so. We're doing another one in West Kentucky in the city of Bremen on August 26th at 10:30 in the morning. So be on the lookout for an email from me. It's not spam. And hope to see you guys there.
Very good. Yeah, and we just wanted to make sure everyone knew about the Affordable Housing Conference next week. Hope to see many of you all there. I feel like we've got just lots and lots of great sessions lined up. The governor will be there. It should be a great couple days.
Thanks, Wendy. Does anybody have any suggestions or agenda items for our next meeting in October?
Madam Chair, we had originally talked about having this is Lisa Barron, having a presentation at this meeting on the price program that KHC is going to be administering with the Department of Local Government. And we couldn't do that this time. So if possible, we'd like to put that to the next meeting.
Okay, sounds great. Anybody else? Okay, I guess we just need a motion for adjournment.
This is Cedric. I motion for adjournment.
Do you get all that, Lisa?
I got Cedric. Did we get a second?
Jennifer Decker, second. Thank you.
Thank you.
All right, thanks, everybody. We'll see you in October.